All right, welcome back to Burt's Basics. My name is Peter Burt. I teach at Boxelder High School, the greatest high school in the world. And today we are finishing up the nervous system. So, you guys have learned the lobes of the brain, the parts of the brain. You've learned nerves and nerve impulses and neuroglia and everything in the world. And now we're hoping that we can put it all together in the last standard, which is 14 about diseases and disorders. So, let me get rid of my face. Pow. And this is what we're going to be learning today. So these are the diseases and disorders you're supposed to know. ALS, Alzheimer's, bacterial meningitis, cerebral palsy, epilepsy, MS, also known as multiple sclerosis, Guillain-Barré syndrome. I've heard people pronounce that 1,000 times in 1,000 different ways. Guillain-Barré. So I'm going to call it a Guillain-Barré syndrome, but if your teacher pronounces it differently, that's okay. Parkinson's and cerebral vascular accidents. So what we're supposed to do is we're supposed to identify the following diseases and disorders of the nervous system. So what I want to do is I want to do a picture game. It's not really a game because most of these are actually really scary, but a picture teaching technique where I show you a picture and then you get to guess which one it is. So let's go ahead and give it a shot. So here's your word bank over here. It could be any one of these diseases, and I'm going to show you pictures because I figured this is the best way to teach it. So if we look in the picture, it says a normal neuron, and it says there's neurons affected by these, what they call tau tangles or plaques, and the neuron begins to struggle. So in your mind, is this ALS? Is this Alzheimer's? What are you thinking so far? Let me give you another picture to help you. Also in this disease, it shows deterioration of the brain, especially in two regions, frontal lobe being one of them and occipital lobe being another. This is a picture of Alzheimer's disease. So now let's talk about Alzheimer's really quick. I'm never going to ask you questions like this, even though I think these are amazing. Like this right here, where it affects 11% of the population. I think that stat is staggering, but I read in the news yesterday they think it's definitely on the rise. But I'm not going to test you on that because those are hard to test of. I think that we could talk about this. Dementia is a huge umbrella. So we want to think of this. Think of dementia as this giant umbrella that affects a lot of our elderly population for dementia, and Alzheimer's just one of the branches hanging off underneath dementia. We can do that as well. But this is what I want right here. We're trying to do keywords so you don't have to memorize everything on the planet. And it's this one, atrophy or atrophy of neurons. Now, most of you have taken med terms, so you know what A means and you know what troph means. That means without nourishment or without being fed. So the neurons begin to die. And when the neurons begin to die, then the brain literally begins to deteriorate. This is also associated with memory loss and lots of other things as well. Alzheimer's is a pretty scary thing. Okay. Once again, I'm kind of going fast so we can see how you do. So once again, here's our pictures here. So you can kind of see that these are your choices. If you see these two, you should probably know who this is. So for example, this guy over here, I'm guessing most of you know who that is. That is Lou Gehrig. So now that means one of these diseases over there is commonly called Lou Gehrig's disease. But Lou Gehrig's disease doesn't give you any idea what the disease actually is or what it does. That's called an eponym. That's named after a person. We're trying to get rid of eponyms and try to give you actual scientific language instead. So this is this picture. So now this picture makes a lot more sense. We have a nerve going to a muscle. So this must be a motor neuron because motor neurons stuck to muscles and or glands. But then for some reason, this neuron begins to die. And right there is his name. This is the almighty ALS. And it says ALS kills a motor nerve cell causing muscles to weaken. So can we do the words really quick? A, without, myo, muscle, troph, nourish or fed. The muscles are getting lack of nourishment. Lateral, it's in the peripheral nervous system. If we go back, okay, this is all about what nerve again? It's all about a motor neuron. Okay, and sclerosis, scler, to harden. This is Lou Gehrig's disease. Amyotrophic lateral sclerosis, also known as ALS. And what I want you to know on this one is the following. It's called muscular weakness, but it's not necessarily the muscles problems. It's atrophy. It's atrophy of motor neurons. That's what it is. The problem that we have with this, guys, is these ones are a little bit scary, especially if you have these in your family. These are difficult because a lot of these give us more questions than we have answers. You're going to see the word idiopathic a couple times a day. Idiopathic means we don't know what causes them. And worse, most of these we don't have cures for. We take medications to treat the symptoms, but most of these we take things to slow. But this is amyotrophic lateral sclerosis, an atrophy of motor neurons, okay? Degenerative disease just means it gets worse as it progresses, and right now there's no known cure. On the test, we could say what's a disease commonly called Lou Gehrig's disease, and ALS will be on there. Okay. All right, now this one's a little bit harder. So you got different types of these. So once again, over here in white, you have your choices. Now, obviously, we can get rid of some of the choices. We've already learned ALS and Alzheimer's, right? But it could be any one of these guys here. So we have spastic, okay, ataxic, we have tremor. I know what you're thinking, and you might be wrong here, so let's go ahead and give it a shot. Ooh, hypoxia. Hypo, okay, low, oxy, oxygen. So that means that this is a disease that has to deal with low oxygen. Now, the next pictures I'm going to show, I'm doing them for emphasis. They are kind of sad, some of them, so kind of be careful with what you see. This is what I think of when I think of this disease. And the only reason I think of this is because look at the age of these two here. Okay, this is cerebral palsy. Okay, you know cerebral is your brain, so now let's go ahead and learn what cerebral palsy is. This is a group of motor disorders due to loss of muscle control, but the real question you should ask is why? Why is there lack of muscle control? And the answer is this. During this time frame, so let's look at these numbers. It says during the fetal stage. Now you got to know what a fetus is. When sperm and egg meet in implants, we call that an embryo. An embryo is generally from implantation to week 8. After week 8 until the child is born, we call that the fetal stage. So anytime during the fetal development at birth or in infancy, generally 2 years and younger, if any of that brain gets damaged, generally due to lack of oxygen or developmental purposes, that will result in a disease called cerebral palsy. Okay, so 70% of cerebral palsy individuals are somewhat, we don't use that word anymore. That's just that's an inappropriate word. So let's just get rid of that word right there. Due to the inability to hear or speak fluently. The reason why I have this picture here is because I want you guys to think of cerebral palsy. You tend to be born with it. If you're 16 years old and all of a sudden your brain dies due to lack of oxygen, we don't call that cerebral palsy. We call that something else that is on this list of diseases here. When my child Cooper was born, he came out and the umbilical cord was wrapped around his neck like this, and he was quite blue and panicky. Cerebral palsy is one of the first things that popped into my mind. I think the doctor could see that I was a little stressed, and I remember very vividly, he's like, don't you worry about it at all. He unlapped the umbilical cord, color got back into my son's face, and he's like, he's going to be fine, and he was. But the problem with this is the more you know, the scarier it can be. Like ALS is scary, and so if your grandpa gets diagnosed with ALS, that's going to be a fight that he's going to have to fight, and that's why knowledge is powerful, but you have to understand empathy and sympathy as well. So that is cerebral palsy. Okay, let's go to the next one. Sorry, my spacebar is not working very well. Okay, let's go to the next one. Oh, the next slide is an anatomy picture, so I'm just warning you, kind of be careful. You can see here's a picture of a brain. They're pulling back the coverings of the brain called the meninges. So this would be your dura mater that has in the tweezers here. And these are the things that would be on the brain. So since I said meninges, I'm guessing you can figure out which one this is. And this would be bacterial meningitis. Okay, and remember, meninges are the coverings of the brain, and itis is just inflammation. This is caused, I mean, you can have viral meningitis too, but bacterial meningitis is what I'm going to test you on. Affects children, severe headaches, fevers. They can do a spinal tap to pull out spinal fluid to see if there's anything in there. If left untreated, can be quite dangerous. Trust me, you want your meninges to be safe at all times. Okay, next picture. Okay, so up here we have a nerve fiber that's surrounded by myelin, and then looks like we have some spaces here, right? Nodes of MVA. There's normal, inflamed, detached, and scarred. So it says here scarred myelin. So if I say scarred myelin, you know one of these words up here means to scar or to harden. And we've already done that before. We did that in ALS. This is amyotrophic lateral sclerosis. So ladies and gentlemen, this is multiple sclerosis. So this is a progressive destruction of the myelin sheath found in the central nervous system. Now, there are lots of forms of MS. There's lots of people that you probably know that have MS, and there's some people that you know that you didn't even know they had MS. And they flare up and they have medications try to slow it down. Don't have medications to cure it, but have medication to maintain it and to slow down the degradation process. The reason why they call this sclerosis is because you get these many scars or hardened areas of plaque on nerves found in the central nervous system. And that's why they call it multiple scler, or multiple scars, or multiple hardenings. Okay. Cause is unknown. They have some kind of theories about what causes it. They're getting better and better at trying to get this out of the idiopathic region. But once again, a lot of these diseases are so many different varieties. It's very difficult to tell you exactly why the myelin sheath is getting destroyed. Now, I want to make sure you guys see this as well. Okay, Guillain-Barré syndrome. If you look at the picture, it's almost the exact same picture. So you're like, well, look, I have a myelin sheath in a nerve and it's starting to get destroyed. So what in the difference is between MS and Guillain-Barré syndrome? It's all about its location. If you notice, MS was found mostly in the, was found in the central nervous system. Well, Guillain-Barré is found in the peripheral nervous system. So there's also some theories to this being an autoimmune disorder about how the cells are destroying one's own myelin. There's still a lot of work going into Guillain-Barré syndrome. It's actually a fairly rare syndrome, but it's very, very similar to MS, just in a different location. Okay, next one. We have rolling movements, different kind of movements there. We have shaking. We have a gait, which is just explains a walk. Persistent tremors. This one right here is Parkinson's disease. Now, when we look at Parkinson's disease, it's a progressive disorder, but I want you to know this right here. It's all about chemicals for Parkinson's disease, and it has to deal a lot with these guys. Now, these guys are guys who go in between nerves. If you guys remember, we talked about how nerves release chemicals. These chemicals are called neurotransmitters. So when we talk about Parkinson's, we're talking about neurotransmitters, especially dopamine and acetylcholine. That's what Parkinson's disease. It is a progressive disorder. We have treatments that we try to manipulate the neurotransmitters. It is a very difficult disease to try to help maintain. There's so many notes in your packet about this that causes about muscle weakness and the spreading tremor. I'm going to go past those because I just want to keep going with all these videos that we have. Okay, this one. I like this picture because it looks like a lightning storm in the brain. And every time I think of this, I think of a lightning storm in the brain. You might see it more like this because this is what an EMT or first responder would see instead. And this one right here is epilepsy. These are short, recurrent, periodic attacks of the motor and sensory and physiological malfunction. Now, you can say a seizure, but a seizure and epilepsy are not synonymous. If someone has a brain injury, they can seize, and they can have involuntary skeletal muscle contraction. That's what a seize generally is: loss of muscle control and ability to have some problems with consciousness. Now, before I started teaching this, I looked it up online, and this can change because, like I said, I made these videos a while ago. If someone has one seize, that does not make them epileptic. But right now, the current theory is if you have more than 2 seizures in a calendar year, then you're generally diagnosed with epilepsy. It used to be 3, and so it does change depending on what we do. But the key is you have to have 3 seizures that are not caused by trauma. So if you get hit in the head, that's different. But if you're just sitting in your chair and all of a sudden you start seizing and it wasn't trauma-induced, those are the ones we're kind of stressed out about, epilepsy. Okay, this one, facial droopness, arm weakness, speech difficulties. I believe this is the last one that we have to cover, and this is CVA. CVA stands for cerebro, which is your brain, vascular, accident. So once again, cerebro is your brain, V is vessels. This is similar to cerebral palsy, but this is generally not in the fetal stage or younger than age 2. So in this one, the most common brain disorder, and it's commonly called, the number one question I'm going to give you is this: everyone calls it a stroke. The scientific name is going to be a CVA, cerebral vascular accident. Now, when we talk about blood vessels, we'll talk more about different types of strokes. There's hemorrhagic, where a blood vessel will tear and you will cause excessive bleeding, causing the brain tissue to die. There's also ischemic stroke, which is a narrowing of blood vessels, generally clotted, so it can't get the blood supply it needs. But a stroke is just characterized by lack of blood to the brain, and the brain vessels will die. FAST is going to be on there. This is facial droopage, arm weakness, slurred speech, and time. It's just an acronym we need to get to the hospital as fast as you can. All right, guys, I'm up on my time on this video, so let's go ahead and do your questions. So here's your questions. Go ahead and write down 1 or 2 keywords about each of these. I I hope that, sorry that was so quick, but I hope you guys enjoyed this video, and thank you for watching Burt's Basics, and I will see you on the flip side.